Good afternoon, happy Sunday, and welcome to the season finale to the Late Night Afternoon Show, a show dedicated to informing the public and having a good time while doing it. Today we'll be discussing the origins, symptoms of the coronavirus, and its mechanisms, how it functions within the human body. We'll look into the rising cases in the different areas of the United States, the implications of these cases, and how they are subject to scrutiny. In this show, we will also cover the alarming effects that the virus has on the economy and how your government is hardly working to address these issues, along with its devastating effects on our healthcare systems. I'll then end the broadcast with a comprehensive guide to protecting yourself during this pandemic. And now, without the participation of your community, the deaths of thousands of Americans are at stake. With that, let's jump right in. Firstly, let's talk about the origins and pathological functions of the SARS-CoV-2, better known as the coronavirus, COVID-19, and to our glorious leader Donald Trump, the Kung flu. The type of coronavirus were discovered in the 1960s when researchers Tyrrell and Belongia uncovered a similar virus in the upper respiratory tracts of patients infected with a common cold. Tyrrell went on to continue studying these types of viruses and naming them after their crown-like shape, giving them the name coronaviruses. Before we deep dive into these particular strain of virus, let's talk about the basics of viral infections. According to Princeton University's textbook definition of viruses, they state that it is an infectious agent that is not a cell that consists of genetic material in the form of a nucleic acid molecule, usually in a protein coat, and is capable of directing its own reproduction and spread by co-opting machinery inside the host cell it invades. This definition is very confusing, but to break it down in layman's terms, a virus is an adaptive, microscopic, self-sufficient organism that infiltrates, invades, and destroys the host and can vary in size, shape, and contraction. This is a very basic definition. Unfortunately, it's ever-changing science, and as we discover more viruses, the definition of what a virus is changes with every new discovery, making it harder and harder to expand and create a solidified definition. And enough of general virus nature, let's take a deep dive into the background and history of everyone's favorite virus, the coronavirus. Truth be told, the threat from this strain of virus has far outdated the current pandemic. This strain starts in 2002 in southern China. This disease was labeled as SARS, or Severe Acute Respiratory Syndrome, and was found to be originated from a species of bats, then to an obscure species of South Asian cat called a civet, and then finally to humans. The strain of the virus quickly spread and had a fatality rate of nearly 10% of its victims. But with the coordination of the virologists around the world, the virus was quickly quarantined and squashed, with no cases reappearing until 2012. The virus this time decided to rear its ugly head in Saudi Arabia, this time taking on a new name, the MERS-related coronavirus or Middle Eastern Respiratory Syndrome. This time it was spread from bats to camels, but was then found not to spread as easily to humans, making it easier for virologists to quarantine and stop the spread of the novel virus, preventing it from transforming into something uncontrollable. Enter COVID-19, a new strain of these viruses that caused countries to shut down and the world to declare an unprecedented state of emergency. Now, a lot like the human immunodeficiency virus, or HIV, this virus compromises the overall health of the patient and leads the way for other infections such as bronchitis, pneumonia, and other life-threatening ailments that can cause serious damage and death. Unfortunately, the human race has not developed a vaccine to combat this, and it continues to infect folks. As it continues to infect folks, the likelihood of its mutation increases as well, giving way to the possibility of it to mutate into a new strain that's even worse than the first one. Now let's take a step back from the dirt on the virus and let's refocus on how it's detrimental to the health of the average human being. For most hospitals around the country, a symptomatic COVID-19 positive patient must be placed on an augmented breathing device, allowing for air to be forcibly pushed in the lungs of the patients. Now, some of these devices can be used while the patient is conscious, but others require for the patient to be placed into a medically induced coma in order to allow the patient to breathe, which can cause a whole number of other health-related issues, including limb clotting, septic shock, amputations, and bed sores. A particularly macabre example is the famous Broadway television star Nick Cordero, who spent months in intensive care, had to undergo a leg amputation, and eventually succumbed to septic shock just from being compromised from the coronavirus. So we know about the origins of the virus and its very real threat to the world's safety. Let's transition into our government's reaction to this ongoing threat to your and I's safety. And now our top politicians can't seem to grasp the magnitude of the situation. The president himself, over the course of the pandemic, has downplayed the severity of the issue, claiming multiple times over the course of his term that the virus will simply go away, and even recently explaining on an interview with Fox and Friends that the virus was going to disappear by election time. The president is just a figurehead at this point, so most of his statements can be taken with a literal grain of salt. But let's take a look at some hard facts. California is currently one of the epicenters for a new outbreak of COVID-19 cases, but shockingly are underreporting the majority of their cases, citing a glitch in the California Disease Information Exchange, which is the database for the state's information about the virus outbreak. Officials are scrambling to fix this glitch because they're completely in the dark about the growing case trends and the accuracy of their total number case data. Dr. Mark Galley said on Tuesday, August 5th, that for days, California hasn't received full counts of the number of tests conducted, nor the number that came back positive for COVID-19. And this is not the only state to attribute its plateau in cases to outside interference. Florida as well saw a drastic lead time in their cases due to the hurricane that blasted the coast on August 3rd and 4th. The state closed down the majority of their testing sites due to the storm, leveling off their cases to around 4,000 infected per day. The case number has doubled over the last week, with August 8th seeing around 8,000 new cases. Now for some breaking news about this topic. The U.S. today, according to Johns Hopkins University, has hit a record number of 5 million confirmed cases, just 17 days after hitting 4 million, with over 162,400 deaths, leading the world in death count and accounting for around 22% of the world's total deaths from the virus. If that's not completely and utterly alarming and scary to you, let's take a look at what our favorite congressmen and senators are up to, shall we? On Friday, August 7th, GOP senators rejected a bill that would extend advanced unemployment benefits for Americans and reinstitute the federal moratorium on evictions. The bill passed the House of Representatives unanimously over 3 months ago, and our favorite Republicans decided last week that they would finally try to make something work, and they have. This unemployment benefit is keeping a lot of folks afloat during the pandemic, even being some families' only source of income to feed their children and themselves. For all the people out there struggling financially and trying to stay safe from the pandemic, this is what Treasury Steve Mnuchin has to say to you. I think we are very clear on we're not going to pay people to stay at home than to work. Thanks, Steve. Really appreciate that, especially when jobs are literally falling off trees. Oh, wait. The U.S. is still standing at a 10.2% unemployment rate, with over 16.3 million Americans still jobless during the pandemic. Although the jobless rate has dropped significantly from the spring, there are still a number of alarming signs that we are seeing that points to the fall time being one of the toughest winters the United States has faced in a long time. Dr. Edward Belongia and Dr. Michael Osterholm, both directors for Center for Clinical Epidemiology and Population Health and Center for Infectious Disease Research and Policy, released a very troubling editorial on the subject. Before we get to that, let's just establish that these guys are like the superstars when it comes to infectious disease, with Dr. Osterholm authoring more than 300 papers and 21 chapters on the subject of diseases, and Dr. Belongia being well-versed in multiple areas of government having to do with infectious disease control and prevention. So when they give a warning like this, everyone should listen. The editorial is rightly named COVID-19 and the flu, a perfect storm. It details their theory that due to unknown reactions between the influenza strains and COVID-19, there is a possibility that both illnesses will see a peak at the same time and cause a massive spike in cases and a possible overcrowding of hospitals. With the number of cases increasing, they stipulate the necessity for social distancing measures, stating that if a surge in COVID-19 cases occurs this fall, tightening mitigation strategies will be necessary. Social distancing and stay-at-home orders are socially and economically disruptive, but can reduce demand on hospitals and protect vulnerable populations. They will also reduce the transmission from other respiratory viruses, including influenza and respiratory syncytial virus. Basically, what these super geniuses are trying to tell us is that we definitely need to get our act together and get a handle on this virus before cold and flu season, or we will be experiencing a 12 Monkeys style apocalyptic level state of emergency coming this fall to a town near you and me. Throughout this broadcast, we've covered quite a few scary topics, but hopefully this gives you, the viewer at home, a clear picture of the state that we are in due to COVID-19, and how without all of our efforts, we still may be in trouble for a long time. Before we conclude this broadcast, I would like to take a little time to explain some of the reasons behind safety measures such as masks and social distancing. So airdrops are expelled from everyone's faces when they breathe, sneeze, or cough. When a person is infected with COVID-19, these air droplets disperse and are known to stay in the air for long periods of time, up to 30 hours, and can travel up to 30 feet or more away from the person expelling them. With the implementation of face masks, the air particles are stopped from entering or leaving your mask when worn properly. The same goes for social distancing guidelines and outdoor seating. This is to avoid stagnant particles and to avoid spreading the disease from asymptomatic individuals. Please wear a mask. Stay home when you can. Avoid large gatherings in indoor areas, and do your part to stop the spread and keep everyone safe. With all of our collective effort, we can beat this horrible scourge on our lives and country. A literal biblical level plague infecting millions of Americans and costing thousands their lives. It takes us, the people, the citizens of the United States, not our president or our government. It takes the individual person standing up and wearing a mask to protect themselves and the rest of us. We are the cure, ladies and gentlemen, and it's going to take all of us to defeat this thing and finally get back to normal. With that, thanks for tuning in, and make sure you vote in the upcoming November 3rd election. This is Jackson Pearson, signing off.